Hello, my name's June Rogers and I'm a specialist children's nurse working for Bladder and Bowel UK, and I'm here to talk about step-by-step approach to toilet training. This is going to be about step 3, and you'll have seen from step 1 about setting the scene, changing the nappy in the bathroom, introducing the potty, talking about wheeze and poos. Step 2 is about developing the skills that were needed, thinking about washing hands, pulling pants up and down, introducing the potty or toilet on a more regular basis. And today in step 3, we're talking about raising awareness, and that's raising awareness for the child in terms of wheeze and poos, but also for parents so that we can identify how often our child is weeing or pooing. Now, if a child in disposable nappies, this is quite difficult to suss out. So what we suggest you do is pick a few days where you're going to have a good run, not going to be interrupted, and then inside the disposable nappy, get a piece of kitchen roll, fold it into a little pad, put it inside the nappy, get a piece of paper, and actually there's charts you can use, and at the end of the video there'll be information where you can get the chart, and also instructions about doing what we call the baseline assessment. So what you need to do is, after the first nappy change of the day, put the little pad in the nappy, and then every hour just check. If it's dry, write dry. If it's they've done a poo, write a poo, and also make a note of the drinks. And because what we're wanting to find is there a pattern? You know, they always tend to wee about 20 minutes after a drink, that sort of thing, and how often they're pooing, and how long they can stay dry for. And this is important because what we're now going to introduce is what we call timed toileting. What we're going to try and do is, rather than just sitting on randomly on the potty or toilet, what we want to do is time the sitting on the potty or the toilet, hopefully when a wee or poo is imminent. So if you've done your chart and it looks as though your child can stay dry for about an hour, and then you would sit them on roughly every hour. And this is important because as the bladder fills, they've got stretch receptors in the bladder muscle wall, and as the bladder fills, it starts to send stretch receptor messages up to the brain, and when it's nearly full, that's when you start to get "I need to do a wee" message. And it's important that the child experiences that, particularly as we're looking towards independence and the child indicating that they need to go. So some families I know are really enthusiastic and they'll take their child to the potty or toilet every half an hour or what have you, which is fine at the very beginning when you just want your child to get used to sitting on the potty or toilet. But I think when we're now at the stage when we want to formalise potty training a bit more and put more structure into it, and I think it's important not to sit them on the potty too frequently. And because what we want to do is identify how long the child can stay dry for and sit them on when we think a wee is imminent. And then hopefully the sitting on the potty or toilet coincides with the child getting the message that the bladder is full, and they'll be able to recognise and learn that this message they're getting in their head means I need to sit on the potty or toilet. And parents often say, at what age should this be? Ideally, we need to get to stage 3 round about age 2 to 3, because that is like anything else, the younger they are when you start, the sooner you start, the sooner you finish. But that's not set in concrete. It depends on your child. Some children may be at step 3 actually just before they're 2, and some children may not get to step 3 until they're nearly 3. And some parents will say, oh gosh, my child's 5 and I haven't even thought about toilet training yet. It doesn't matter. You're never too late to start. The key thing is making that start towards toilet training. And as we learned in step 2, children need a lot of skills in order to become toilet trained. So it's important that you follow the step-by-step approach regardless of their age. But obviously, we would always emphasise that the sooner they start, the better. And so by the end of step 3, we're looking at a structured programme when the child is sitting on a regular basis and hopefully getting more consistent wees and poos on the toilet. And once that happens, we're then looking towards step 4, which we'll talk about in the next video. And now we'll show you details of the Down syndrome Facebook, Positive About Down Syndrome Facebook group, which we would encourage all parents to join, and also information about the Bladder and Bowel UK website, where you can download lots and lots of information. Thank you.